here with Lamar Hasbrouk, the Ulster County Health Commissioner, who has an important message today about tick-borne Lyme disease. What's going on here today at this press conference?
Well, today, fortunately, we have Senator Charles Schumer that's visiting us today, and he's going to help put the spotlight on this very important public health issue, which is tick-borne diseases, and in particular Lyme disease. So he's going to come here. He's going to talk a little bit about the legislation that he's backing, and so we're going to hear his comments and his approach and what he has to offer in terms of disease prevention.
And how is your office involved in fighting Lyme disease?
Sure. Well, as the local health department here for Ulster County, we track the numbers, we track the surveillance in terms of the cases, and not only Lyme but other tick-borne diseases such as babesiosis and ehrlichiosis. And we track these numbers to see if there's any upticks. And in fact, over the last couple of years, we have actually surpassed Dutchess County, which is typically the leader in this region in terms of our incidence or our cases per population here. So we are now the epicenter here in Ulster County. We have doubled over our efforts in terms of our prevention strategies. We disseminate tick removal kits. We do about 3,000 of those every year. We identify ticks for residents who want to come in, bring a tick in, and we can take a look at it and identify it and see if it's, let them know if it's one of those high-risk ticks that might be likely to transmit diseases. We also have an education campaign. We go out to schools and health fairs, etc. And we're about to launch another ad campaign around being tick-free.
Is the margin between Dutchess and Ulster a significant one, or is it pretty close?
Well, the most recent data, most recent information shows their rate to be about 177 per 100,000 compared to 200 per 100,000 here in Ulster County. In 2009, it was actually our rates were twice those of Dutchess County. So yeah, it is concerning. In the worst case scenario, my worst fear is that our rates have gone up because of the lack of vigilance here in our residents in terms of the prevention strategies.
And over the river, have the rates in Dutchess County gone up, gone down, or stayed the same?
I think they're trending upwards as well. You know, there's been a change in the case definition, the way we define Lyme disease, so that might account for some of the differences as well.
Can you tell me, is there any movement towards alternative tick prevention methods, such as keeping Cornish game heads in your yard, or using certain types of techniques, certain types of corn with medicine on them that the deer would eat?
That's an excellent question. I'm not aware of them. Certainly the Department of Health has not been involved in that science or in those approaches up to this point.